Ghana should brace itself for more mental health challenges as the economic crisis in the world surges. Now, that's the warning by mental health experts at the Ankafu Psychiatric Hospital and the University of Cape Coast. The experts say that the aftermath of the COVID-19 pandemic and other economic challenges have created huge problems for individuals and families in Ghana and the global community at large. There's more in this report.
You're witnessing a whole lot of social issues, even quite recently. You're witnessing the gentleman that was flogging the baby. All these things have psychopathology because we feel that the financial crisis is going to have a lot of toll on us. The armed robbery, the galamsey, the ritual killing, all of these have economic dimensions that is bordered on what? Mental health. So we need to really brace ourselves for more challenges. And we're calling upon the government to do whatever it takes to resource and look at mental health as a priority for Ghana.
The head of department of the School of Nursing and Midwifery, as well as the mental health at the University of Cape Coast, Dr. Jerry Paul Ninoni, speaking about how the economy is affecting families and individuals, many of whom he says are resorting to diverse means of surviving.
The whole world, economically, is about going into recession. And what that means is that people struggle to find money to cater for their children. People struggle to find money to do other things, and their daily life is going to be disrupted. So we are seeing that mental health is going to be a global priority, all because of the economic consequences emerging from COVID-19 will have a toll effect on all of us. And it's a challenge for every nation to plan ahead for the mental health challenge that's going to come, because the unemployment and the job issues are not going to go away anytime soon. But it can only get worse and gets better. And that's why we feel that at the family level, at the workplaces, organization level, every stakeholder must make every necessary effort to be able to respond to emerging mental health cases that may come as a result of the global economic crisis we are going through.
He believes the mental health sector should be adequately resourced to enable them provide some support mechanisms to help people deal with the mental health traces that are arising as a result of that.
And when you even look at it generally, we still have trained doctors, trained nurses who are in the house. For about 2 years now, they've not been posted. All these are having an effect on the mental health delivery system. So we're calling upon the government, let her do something in staffing and resourcing the mental health sector to be ready for this aftermath of COVID-19, which is going to have a lot
at the Ankafu Psychiatric Hospital. Dr. Kweju Mafo, being on his part, believes prioritizing mental health issues at this period in the country's life is crucial and non-negotiable.
I have to emphasize that most of this lost productivity is due to what we call minor disorders such as anxiety and depression. Most of this money lost. Majority of that 1 trillion is depression, not working properly at work. Very little of it is actually the major mental disorders like schizophrenia that we tend to think about. Because those people tend to be excluded from the workplace. They are not well enough to have had a job to lose. They are not well enough to be in a job and not be performing. So majority of this impact is the anxieties and depression, the things that we overlook.
A recent research conducted by some mental health researchers in Ghana revealed that in Ghana, 21% of the working age adults experience moderate to severe mental health disorders.
Thanks for your time, and of course, do have a pleasant weekend. For more, log on to www.myjoyonline.com. My name is Pakwesi Shandov. The show continues with Benjamin Akakpo and Benes Abu Beidu Lansa. Stay